Return to work COVID-19 training for HPD staff. The objectives of this training is to help you understand ways to limit exposure, understand ways your work environment might be impacted by the pandemic, know where to find available resources, provide you with information on COVID-19, explain teleworking and returning to work sites, what to expect at HPD sites upon returning to work, provide resources on recommended precautions, safety measures implemented at HPD, and how to manage stress, and provide points of contact should you have questions or concerns. Coronavirus is an illness caused by a virus that can spread from person to person. The virus that causes COVID-19 is a new coronavirus that has spread throughout the world. COVID-19 symptoms can range from mild to severe illness. Symptoms may appear 2 to 14 days after exposure to the virus. People with these symptoms or a combination of symptoms may have COVID-19. Some of the more common symptoms are cough, shortness of breath or difficulty breathing, fever, chills, muscle pain, sore throat, new loss of taste or smell. The New York City Department of Health and Mental Hygiene is currently investigating cases of pediatric multi-symptom inflammatory syndrome in children which might be related to having COVID-19. PMIS is a rare condition that is not contagious. However, because it is life-threatening, it is important to know the signs. Most children have a persistent high fever lasting several days, along with the other symptoms which are listed below. Should your child be experiencing any of these symptoms, be sure to contact your healthcare provider. If you have any of these emergency warning signs for COVID-19, please get medical attention immediately. Trouble breathing, persistent pain or pressure in the chest, new confusion or inability to wake up, blue lips or face, other unexplained serious symptoms. There are different modes of transmissions for COVID-19. It is believed that the most common mode of transmission is person to person. Between people who are in close contact with one another, through respiratory droplets produced when an infected person coughs, sneezes, or talks. Droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Recent studies have suggested that COVID-19 may be spread by people who are not showing symptoms, people who may have COVID-19 but are asymptomatic. It may also be possible that a person can get COVID-19 by touching a surface or object that has the virus on it and then touching their own mouth, nose, or eyes. This is not thought to be the main way the virus spreads. Currently, there is no vaccine for COVID-19. There are several clinical trials occurring in the U.S. as well as New York State. As these efforts progress, more treatment options may be established. In the meantime, there are known precautions we can take to protect ourselves and our families and coworkers and limit exposure. Older adults and people who have severe underlying medical conditions like heart or lung disease or diabetes seem to be at higher risk for developing serious complications from COVID-19 illness. Please note that you could spread COVID-19 to others even if you do not feel sick. You may be asymptomatic. In order to help protect our coworkers and ourselves, We must all take the proper precautions to prevent transmissions of COVID-19. There are 4 main ways we can protect ourselves and others. Wash your hands often, cover your cough, avoid close contact with others, use mouth and nose coverings. Wash your hands often with soap and water for at least 20 seconds, especially after being in a public space or after blowing your nose, coughing, or sneezing. If soap and water are not available, use a hand sanitizer that contains at least 60% ethanol or 70% isopropanol. While alcohol can also break the oily membrane of COVID-19, washing with soap has the added benefit of physically removing even tougher to break viruses and bacteria from the skin. Also, remember, if you feel sick, please stay home and notify your supervisor. Your work areas are regularly cleaned. This includes disinfecting high-touch areas daily. When there is a positive case, a targeted disinfecting cleaning is conducted. Products used for cleaning are listed below. Social distancing means keeping space between yourself and other people. Stay at least 6 feet from other people. Do not gather in groups. Stay out of crowded places and avoid mass gatherings. Social distancing helps limit contact with infected people and contaminated surfaces. At HPD, we have implemented measures to help increase social distancing. Here are some examples of signage you will see upon reporting to 100 Gold Street. The front desk has also been reconfigured to adhere to social distancing guidelines. It is strongly recommended that you wear a face mask at work, even if you are able to maintain 6 feet of distance from others. Remember, you could spread COVID-19 to others if you do not feel sick. You may be asymptomatic. The face mask is meant to protect other people in case you are infected. Continue to keep about 6 feet between you and others and practice good hygiene. HPD will provide you with a face mask when you physically report to work. You may use your own face mask as long as they meet HPD criteria. There are rare cases in which an employee cannot wear a mask for extended periods or at all. In such cases, the employee should contact the EEO office for more information about requesting a reasonable accommodation. Reusable face masks fit snugly but comfortably against the face with ties or ear loops. Cotton is preferred and made of multiple layers, which allows for breathing without restriction. Can be laundered and machine dried without damage. Disposable masks. Loose-fitting disposable device made of filtering paper layers. Creates a physical barrier between mouth, nose, and the immediate environment. Please note that face masks with exhalation valves are not allowed. At HPD, you are required to wear a face mask in the following circumstances: in any common area, such as hallways, lobbies, bathrooms, elevators. If you are engaged in work tasks for which you cannot or anticipate that you may not be able to maintain social distancing from others of at least 6 feet. When you interact with the public, such as during inspections or any outreach events.
To put on a medical mask, first wash your hands with soap and water or hand sanitizer. Then, remove a new mask from the box and make sure there aren't any tears or holes in it. Locate the top edge of the mask, which is the stiff, bendable edge that can be molded to fit your nose. Make sure the colored side of the mask is facing outwards and the white side is facing towards you. Then, place the mask on your face so it's covering your nose and mouth. If the mask has 2 ear loops on either side of it, Wrap these around your ears to hold the mask in place. If the mask has ties on it, position the top ties over the crown of your head and tie a bow to secure them. Then, do the same thing with the bottom ties at the nape of your neck. For a mask with bands, pull the top band over your head so it rests on the crown of your head. Then, pull the bottom band over your head so it rests on the nape of your neck. Mold the stiff edge at the top of the mask to your nose, and pull the bottom of the mask down so it's covering your mouth and chin. When you're ready to remove your medical mask, wash your hands with soap and water or hand sanitizer first. Then, remove the mask using the ear loops, ties, or bands. Avoid touching the front of the mask since it could be contaminated. Finally, throw the used mask in the trash.
It's important to wash your hands before and after putting on a mask. When taking a new mask out of the box, inspect it for any tears. Locate the bendable part of the mask, which can be molded to your nose. If you are wearing a disposable mask, make sure the white side is touching your skin and the color part is facing out. Place the mask on your face and mold the bendable part to fit your nose. Make sure your mask is covering your nose and mouth. Put the loops around your ears, or if your mask has ties, tie one pair of strings to the crown of your head and the other to the nape of your neck. When taking the mask off, wash your hands first. Take off loops from your ears or untie. Don't touch the front of your mask because it may be contaminated. Throw the mask in the garbage and wash your hands after. Although reusing face masks is not recommended, disposable masks are in very short supply. To conserve scarce resources during the pandemic, face masks should be reused whenever possible. Properly care for it by storing it in a clean, breathable container and keep it in a secure location. Do not wear your face mask around your neck when not in use. If you are using cloth coverings as a face mask, store them in a secure and breathable container and wash them regularly. You can continue to use a paper face covering throughout the day until it becomes damaged, dirty, or wet. Replace masks if they become damaged, ripped, or heavily soiled. Disposable masks should not be used for more than one outing because they cannot be properly cleaned. Do not use disinfectant spray on masks or share them. Be sure to check your temperature before completing the health screening assessment. Digital thermometer. This provides a quick and highly accurate body temperature reading. Normal temperature can vary from 97 degrees Fahrenheit to 99 degrees Fahrenheit. If you have a temperature of over 100.4 degrees Fahrenheit, please stay home and seek medical attention. How to use. Press on/off button to activate. A flashing low indicates it is ready to be used. For oral use, place the probe under the tongue near the heat pocket and close your mouth. Wait until thermometer beeps. Axillary use. Wipe underarm with dry towel and place probe tip under the arm with probe perpendicular to the body. Before and after each use, make sure to clean the thermometer with a soft cloth and isopropyl alcohol diluted with water. As an additional precaution, HPD is implementing a health screening procedure. All employees, including field staff not physically reporting to an HPD office, are required to undergo this screening prior to physically reporting to any HPD worksite or performing in any field staff duties. Before reporting to a worksite, you must complete an online assessment. After the assessment, you will receive immediate instructions on how to proceed with your workday. If you are unable to complete the electronic health screening assessment before getting to the worksite, then you must complete it as soon as you get to your workstation. Remember, if you do not feel well, stay home. If you have been in close contact with someone with a confirmed case of COVID-19, you must self-quarantine for 14 days and follow your healthcare provider's instructions. All HPD sites will have the following sign posted at employee entrances. Notice to all building employees: by entering this building, you are affirming that you have completed your agency's health screening assessment and are cleared to enter. By entering any building, employees are affirming that they have taken their agency's electronic health screening assessment and are cleared for entry. Employees who are cleared to physically report to an HPD worksite must verbally affirm to the officer or guard at the worksite that they are cleared for entry. Physical verification is no longer required. If an employee cannot affirm that they are cleared, they will be provided with the screening questionnaire for building employees. DCAP's police or security personnel will request that only employees who have not completed the electronic health screening assessment read the questions and verbally confirm that they are cleared to enter the building. There is no paper health screening assessment provided that the employee has to complete. Remember, if you are unable to complete the electronic health screening assessment prior to reporting physically to work and provide a verbal clearance to security personnel, once you report to work, you must go to your workstation and complete the electronic health screening assessment as soon as possible. Employees not cleared for entry will not be allowed to report to work and must inform their supervisors consistent with normal leave policies and contact Human Resources for next steps. If you answered yes to any of the health assessment screening questions, you must follow the instructions below. You must notify your direct supervisor immediately that you did not pass the health screening assessment. For city time, employees not cleared for entry due to answering yes to questions 1, 2, or 3, please record the leave type as excused and the reason as other excused. For those not cleared due to answering yes to question 4 on travel, please contact Evelyn Taveras, Director, Employee Relations, at taveras@hpd.nyc.gov or 646-357-0892 for additional guidance. Once you complete the assessment, you will receive an email response letting you know if you are cleared to report to work or not cleared to report to work. If you are not cleared, you must contact your supervisor and inform them of such. To help protect HPD employees, a work schedule plan will be in place to maintain social distancing. This may include changes such as staggering shifts, continued teleworking, and reconfiguring workspaces. The outbreak of COVID-19 may be stressful. Fear and anxiety about a disease can be overwhelming. You may experience changes in sleep patterns, difficulty concentrating or sleeping, worsening of health problems or mental health conditions, increased use of alcohol, tobacco, or other drugs. There are resources available that can help you cope. You may contact the Employee Assistance Program, or you may reach out to WorkWell New York City. Employees returning to duty from a COVID-19 related absence should provide a note from a healthcare provider that states they are cleared to return to duty. The note should not include any specific medical information and should be provided to the manager, supervisor, and forwarded to timekeeping as supporting documentation for the absence. If an employee is unable to obtain a note from their healthcare provider, they may reach out to Evelyn Taveras, Director of Employee Relations, for guidance. You cannot return to work unless you have at least 10 days without symptoms or 3 days since the resolution of fever without using medication, whichever is longer. If you are out for 5 days or more, you are required to provide a note from a healthcare provider clearing you to return to work with or without restrictions. If restrictions are indicated, please contact Zenzali Vialva, EEO officer at HPD, to discuss reasonable accommodations. Discrimination is unlawful. treating people unfavorably because of health status, race, or national origin, or their association with a person of a certain racial or national group, whether actual or perceived, is a violation of the city's EEO policy. If you have concerns in reference to discrimination, please reach out to the EEO office. For additional information on the virus, protective measures, or any information reviewed in this training, please visit the HPD intranet. You may also review the Department of Health and Mental Hygiene's COVID-19 page. They also have information on guidance on commuting safely during the COVID-19 public health emergency. You can email questions to askhr@hpd.nyc.gov, and you can also visit the Centers for Disease Control and Prevention COVID-19 page. Please ensure that you are taking all the necessary measures to prevent the spread of COVID-19. Stay home if you are sick. Keep physical distance. Wear a face covering. Keep your